These images were a wake-up call. Even more than the numbers and the projections, this video from a San Antonio food bank distribution event back in April illustrated the economic crisis brought on by the COVID-19 pandemic. Thousands of families in their cars lined up, waiting to receive food.
I was driving the other side of 410, looking over at this line, and at that moment, I said to my team, we are going to need more food. This is insane.
But in the weeks that followed, the food bank CEO, the county judge, and the mayor were among those saying that this public health crisis did not create a new problem, it only exacerbated an old one.
This crisis has revealed a very unlevel foundation with a lot of cracks in it in terms of our economy.
San Antonio has long been considered one of the poorest major cities in the country. We're taking a look at some of the root causes of the inequities we're facing and what it will take to level the playing field.
KSAT Explains.
KSAT Explains. KSAT Explains.
KSAT Explains. On-demand, in-depth perspective. Perspective on stories we bring you in our newscasts throughout the day. We're looking into concerns over voting safety during a pandemic and the battle over mail-in voting. A look at how the protests and demonstrations have played out in our city and an examination of what it means to be black in San Antonio.
An issue that you have likely felt the effects of, rising property taxes.
The roots of Tejano run deep in South Texas. We examine the cultural impact the music has had in San Antonio.
The impact of the pandemic has been uneven in the city.
COVID-19 has spotlighted the inequities in our city that we have known about for years. From access to health care to education, there is a lot to talk about. But let's start with the very basics. Let's look at the makeup of our city. San Antonio is one of the fastest growing cities in the entire country with 1.4 million people. Our city is also what's known as a majority minority city. Hispanics make up 60% of our population, whites make up 30%, and black San Antonians make up about 7%. Over the years, San Antonio has earned a reputation as one of the poorest and most economically segregated cities nationwide. San Antonio Food Bank CEO Eric Cooper has seen that need up close. He says even before this pandemic, there was a problem.
We're above average nationally in need, and that's where San Antonio struggled. There has not been enough opportunity. That segregation of opportunity between the haves and the have-nots is great.
San Antonio's median household income is about $51,000. About 50% of households earn less. The 2018 American Community Survey found that San Antonio has the highest poverty rate in the country out of the United States' 25 largest metro areas. 18.6% of San Antonians live below the poverty line. That's about 20% higher than the state's rate, and that includes 27% of children younger than 18 years old. When it comes to educational attainment, 82% of San Antonians have at least a high school diploma, but only 26% have a bachelor's degree or higher. That's compared to the statewide average of just over 29%. 54% of people who live in San Antonio own the homes they live in. Compare that to 62% of people who own their own home across the state.
A lot of people talk about urban areas like ours, particularly San Antonio, as being a tale of two cities. There are many people in our community that the pandemic is an inconvenience, for sure. It's an inconvenience. But their livelihoods are by and large intact. But there is a whole other side of this world, a whole other side of our city, where people are not as fortunate.
There are a lot of factors at play when it comes to the differences in economic status in our city, and often it has a lot to do with where you live.
If you kind of look geographically within San Antonio, you can certainly see there are pockets of lower levels of educational attainment, income, access to the internet. All of those things are kind of layers on each other.
When we evoke north side, east side, south side, west side, that we're automatically evoking race and we're automatically evoking class.
COVID-19 appears to be disproportionately affecting people of color in San Antonio. We told you earlier that black people make up about 7% of the San Antonio community, but people within that community account for more than 15% of coronavirus deaths locally. More than 64 people who are Hispanic have died from the illness, accounting for more than half of the deaths from the coronavirus in Bexar County. In general, minorities are more likely not to have insurance. Take a look at this map here. SA 2020 compiled some data to show which city council districts have the most uninsured people. District 5 has the highest rate with 25%, followed by District 1 with 22% of people uninsured. Then District 3, nearly 21%. These numbers from 3 years ago now, long before this pandemic hit. San Antonio was already known for its high rates of uninsured people before the pandemic.
No surprise that we would also have some of the largest uninsured rates anywhere in the country just due to poverty and demographics. And so that leads to lots of public health issues for our constituents.
Councilwoman Shirley Gonzalez represents District 5, which has the highest rate of uninsured people in the city.
The majority of people working in District 5 were working in downtown.
Hotels, restaurants, the convention center, they were all forced to shut down, leaving people without jobs and many without health care coverage. Even before coronavirus, people in District 5 struggled with obesity, diabetes, heart disease, and asthma, and that puts them at greater risk of becoming infected. The pandemic also highlighted the need for more access to health care.
We don't have as many health clinics as other parts of the district.
The problem in District 5, the buildings are old and there's not a lot of land to build something new.
So it would require a major retrofit of some existing building or a demolition and reconfiguration of a site,
which can be costly. Opening a clinic may also not seem beneficial to some.
There's a disincentive there in terms of opening up a practice or putting a hospital or a clinic, a private clinic, in places where there are fewer people that are able to pay for the services, either with health insurance or self-pay.
The long lines we have seen at testing sites is a testament to the need for more clinics. Back in May, the city set up pop-up testing sites, primarily in underserved and minority communities. People without health insurance can get tested at no cost, but Metro Health is struggling to keep up with that demand. Here's what the former director had to say when a reporter asked whether there were enough free testing sites.
If I were to look at the lines that are coming into our neighborhood pop-ups, the answer to that is no. And so we're trying.
While limited access to health care and high rates of uninsured people existed before this pandemic, health is something Gonzalez plans to focus on moving forward.
An emphasis on health and wellness in the community will help us in the long term to battle these kind of viruses.
The Summer of Me is a hit.
Flintstones, meet the Flintstones.
Stop the music.
These days are out. These days are out.
Gee, what a workout.
Sing along with the Flintstones and Happy Days.
While anyone can get COVID-19, growing data shows that the virus is infecting and killing more people in Black and Latino communities at a higher rate across the country. Nationwide, Latinos have been hospitalized at a rate of more than 4 times that of white people. For Black Americans, the hospitalization rate is about 5 times that of white Americans. Here at home, UTSA professor Rogelio Saenz has been studying the death and infection rates for Latinos since this pandemic began. RJ Marquez breaks down some of Saenz research and tells us why people who study racial disparities say that what's happening today is the result of decades-old practices.
You have overwhelmingly, where Latinos are overrepresented among people infected with the virus.
In his latest report, Dr. Rogelio Saenz noted that Latinos are now overrepresented among people that have contracted COVID-19 in 43 of 44 states that provide information on Latinos, and those numbers only scratch the surface.
Both the Latino and Black communities are younger populations, and because COVID-19 is believed to be a disease that is more dangerous for the elderly, you might expect these communities would be dying at a lower rate, but that is not the case.
Overall, Latinos were succumbing to the disease at about rates of about 2.5 times higher than the white population, and in the case of African Americans, it's still higher, about 3.5 times higher.
Now that states have started to reopen, many Latino and Black Americans have returned to jobs that require them to be in contact with more people and therefore more likely to contract COVID-19. And the death rates are more staggering for the 25 to 54 age group.
You really have the workforce. There you have Latinos dying at rates that are 6, 7, 8 times higher than the white population. The same thing going on with African Americans.
And I think if we're talking about equity, one of the elephants in the room across the board always, including in both of those respective conversations that are related, is race.
In Bexar County, there definitely is this divide that's very closely associated in terms of infection and exposure, that's very closely associated with socioeconomic status, and that happens to also be associated with whether or not you're Latino.
We've also always had that unenviable distinction of being the city with the greatest economic segregation.
Experts say some of our socioeconomic divisions can be traced back to redlining. So what is redlining? Redlining was a systemic denial of government services that impacted neighborhoods with high proportions of minority residents.
It was very specifically saying Black people and Latinos in communities are considered high risk and therefore should not have access to things like home loans, which then affect generational wealth.
Decades later, many communities, including here in San Antonio, still have scars from those practices.
There are thousands of special needs caregivers in our community. Every day they serve as champions of compassion to a family member, a friend, neighbor, or an employer. They have served a special role during this pandemic that cannot be overlooked and must be acknowledged. Let us take this opportunity to thank the caregivers of the special needs community who are serving as warriors through their unselfish desire to make a real difference in the lives of our friends with special needs. Together, we are making a difference.
With education, I think what we'll also see is that the achievement gap is just going to grow wider. In addition to technological resources, a lot of families not having technological resources, households where both parents are still having to work, going into work, means who's taking care of their kids, who's taking care of their education.
Districts 1, 2, 4, and 5 have the lowest rates of connectivity in the city.
We knew that our kids didn't have access to the internet at home, but as soon as everybody went to online classes, that was really the most, I think, stark and urgent need.
Elected leaders, organizations, and individuals have been trying to improve San Antonio's connectivity for years, but the pandemic forced more people to pay attention to the digital divide. Without much time to prepare, teachers had to find ways to educate from a distance via virtual classrooms. But not every student was able to log on because not every student has internet access or the needed technology. And this isn't just an inconvenience, it's leading to concern that students will be left behind.
I am very concerned that we're going to see a greater widening of the achievement gap in education between the haves and the have-nots.
Back in April, this mother of 4 was one of thousands of parents to get a digital device from the San Antonio Independent School District.
We were trying to get all 4 of them on one iPad. And so that was really a challenge.
Other school districts and organizations also collaborated to offer students access to the internet.
It'll help a lot because they can actually have their Wi-Fi to do their work during the day.
But the digital divide isn't just a problem for students.
It provides access to everything, not only being able to have the option to work from home, if that's an option that's available from your employer. It relates to being, yes, physically distanced, but also staying socially connected to family and friends. It's how we've been able to gain up-to-date information about the COVID-19 crisis.
And without access to proper information, it's hard for residents to have access to information they need to make good decisions and stay safe during this pandemic.
We know that it is really hitting hard in communities where there's lower levels of access to preventative health care, to healthy, nutritious foods, to wellness activities in general. And we've seen that further damaged by the fact that the information getting out to communities to protect themselves against this virus is also disparately impacted during the pandemic by the digital divide.
Once again, this is an issue that disproportionately affects Black and Latino households.
Here you going on your vacation, Bunny?
It's the summer of me, your TV vacation destination.
You going on vacation, Sergeant?
Any day away from you, pal, I consider a vacation.
The perfect getaway is right at home.
What am I going to do this summer?
With Me TV. As always, featuring some of the greatest TV shows ever made.
Yes, sir. I'm going to lay around home and just take it easy.
Tonight, storms become likely.
When severe weather strikes.
Breaking into programming for just a few moments, we have multiple severe thunderstorms.
KSAT is live on air and on your Weather Authority app.
You need to seek shelter, okay? Seek shelter.
Use the radar to track the storm's path over your neighborhood. And if you lose power,
just know if you're watching us on TV, you can stream what we're doing right now on the KSAT weather app.
Real meteorologists, real forecasts.
We'll get you through this and we'll let you know when the threat has passed.
Live on KSAT and on your Weather Authority app.
Welcome back. I'm meteorologist Katie Blake, and this is the weather portion of this week's KSAT Explains. So ever since the pandemic began earlier in the year, there has been a lot of speculation about how the weather, specifically how temperatures, would affect the spread of the virus. So now that we are in the hottest months of the year, how will COVID-19 respond to the summer heat? To find out, meteorologist Sarah Spivey spoke with Dr. Ruth Berggren, an infectious disease specialist at the Long School of Medicine at UT Health San Antonio.
Hey everybody, I'm meteorologist Sarah Spivey, and recently with the increase of heat and as we head into the summer months, there's been a lot of speculation on whether or not the heat will actually slow down the COVID virus. Well, I took some time to talk to Dr. Ruth Berggren, who is an infectious disease specialist with the Long School of Medicine at UT Health San Antonio, and here are some things that she had to say.
We all had hoped that we'd get a reprieve from the virus with the heat, and it's been pretty hot here, and as all of us have seen, unfortunately, cases in San Antonio are spiking. So that theory has not borne out. We do know that the virus can survive on surfaces, sometimes for hours and sometimes even days. We also know that it prefers a cooler environment, but what happens in actuality is that when people are outdoors and it gets really hot, they go back inside into cooler air. And so there's really been no benefit to us from this hot weather. And in fact, countries where there's a lot of heat, in Africa, they're also seeing COVID-19. So we really can't expect the weather to help us with the COVID pandemic. It's going to be our behaviors that are going to help us. Thankfully, we don't get it. It doesn't get that hot here. You know, if the virus were on the surface of a jungle gym, you know, metal bar out in our heat, you know, it wouldn't last very long. That's for sure. But that's not how the virus is primarily transmitted. We care about surfaces, but we care more about respiratory droplet transmission. And that's going to happen when two people are within 6 feet of each other for greater than 15 minutes. And you're better off if you're outdoors, not because of heat, but because of the air circulation. But we're trying to get everybody to think about the 3 Ps: prevent, protect, and provide. And what you want to do is prevent others from getting sick, your grandma, your grandpa, and you do that by covering up your own mouth and nose with a mask, knowing that there's a lot of asymptomatic spread, you know, washing your hands, keeping 6 feet apart from other people. But we want people to also think about creating a small social bubble. So you have really defined who are the people that you're going to be interacting with and close to during this time. And that's really going to be mainly the people that are in your household. If you do have to leave your home for any reason, bring the mask with you. You don't have to wear it if you're outdoors exercising, but if you get into a crowded area outdoors, you want to have the mask and you want to put it on right away. And the last P, is provide. So what are we asking people to provide? We want you to provide information if you get a phone call from a contact tracer. The contact tracers are really, really important because they're the ones that identify who's sick and then who's going to get sick next, and they go find those people and put them in quarantine or ask them to quarantine. So if you get a phone call or a text message from area code 210 with the prefix 270, please answer that call, return the call, or answer the text message so that you can provide the information that we need to help control the pandemic. And COVID could start with a sore throat and a cough, but the difference is going to be fever. You're not going to have fever from Saharan dust. You will have fever from COVID. And it's also how sick you feel. So Saharan dust doesn't make you feel great, but it's not going to make you feel achy and bad all over your whole body. So if you just cough, don't freak out. Think, am I having other symptoms that go along with COVID? Have I lost my sense of taste or smell? You know, do I have a fever? Do I feel sick and achy all over? Am I short of breath? If the answers to some of those questions are yes, then you should worry about COVID. If the answer is no, you're probably just experiencing some seasonal allergies or some reaction to whatever is in the air.
So as the summer heat rolls on, I hope you'll find some way to enjoy this summer months safely. For KSAT Explains, I'm Sarah Spivey.
The need for food in our community has doubled since the COVID-19 pandemic. Join the San Antonio Food Bank, KSAT Community, local restaurants, Spurs Give, and the Tim Duncan Foundation in supporting the Spurs Cafe. Just visit the link on your screen and make a donation. The donation you make will send restaurant-prepared meals to families in need. Fight hunger and feed hope today. Find out more at ksatcommunity.com.
KSAT Community, in partnership with RBFCU, University Health System, and Energy Transfer. The night beat. The day isn't over.
It'll be a very tense situation. Folks, this is live.
It's what's happening right now.
He heard the shots and ran for cover.
She was not allowed to record video or take pictures.
More investigations.
Crooks to break into a bar, then drive off with a whole ATM.
You have no idea how long employees were exposed.
More stories affecting you.
This will be a major traffic nightmare.
Working to bring you more.
Night is not over just yet.
The Night Beat.
There has been for a minute complex community challenges that we have known of, and food insecurity is one of them. We also know that none of the complex community challenges exist in isolation, that food security is closely tied to affordable housing in San Antonio. It's closely tied to employment or underemployment or unemployment.
We want to end this show the way we started it, with these images from a San Antonio Food Bank distribution event very early on in this crisis. These incredibly long lines of families waiting for food shows you the dire circumstances that so many of our neighbors have found themselves in during this pandemic. RJ Marquez spoke with the Food Bank CEO about why these images actually leave him with some hope. Thanks for joining us for this episode of KSAT Explains.
It's challenging. We have our ups and downs. Luckily, my wife is still working.
We only get Social Security and it's not enough.
Alfred and Alejandra are just two of the thousands of people who have turned to the San Antonio Food Bank for help since the start of this pandemic.
With the onset of the COVID-19 crisis, we went from feeding 60,000 people a week to 120. So the demand doubled.
In the midst of a worldwide pandemic, the San Antonio Food Bank became a lifeline for South Texans who found themselves unemployed or underemployed.
San Antonio's a hardworking, blue-collar community, and many families are right on the edge. And the COVID-19 crisis pushed many of them over the edge.
The mega distribution event at Traders Village in April received worldwide attention, and it was a wake-up call for many in our own community. It gave some context to the staggering unemployment numbers that were just starting to come in.
It was overwhelming. It was a time when we were just a month into the crisis, and many people's last dollars were spent, and so families needed food immediately.
Half of the families that waited in their cars for hours in line that day had never received help from the food bank before, but in April they simply ran out of options. Many of those families came from the hardest hit industries like food service and hospitality.
In the COVID-19 environment, the collapse of those industries have displaced so many people now that are coming to get food. And they were like, man, I was good. They were just above the poverty line, but not far enough above. Literally that paycheck away from a crisis.
The food bank's mission has always been to serve and nourish the community, but during these strange and uncertain times, the nonprofit has relied on others to help them fulfill that mission.
If it wasn't for our great city and lots of great companies and individuals and food companies and foundations, we would have run out of food. When San Antonio is being selfless and giving something up, they're at their best. And I think that's what I have the privilege of seeing. And it's what I saw at Traders Village. So many people giving, so many people could have something to eat. I think the world saw that, and hopefully we made San Antonio proud.